Hello, everybody. My name is Matthew Molina, and the topic of my undergraduate research is the effects of COVID-19. During China's busiest travel season, many citizens were on their way home to their families to celebrate the Chinese New Year when a change of events happened. Many citizens were plants with a pneumonia-like virus that affected the outer parts of Wuhan, China. The coronavirus, also known as COVID-19, has killed in the thousands and infected around 100,000 citizens. The spike in cases and the easy transmission rate of COVID-19 brought a panic to the healthcare workers and many other communities. The purpose of this study is the comparison of the transmission rates between the US and Laredo. In order to understand what COVID-19 is, we have to identify what the virus is. The word corona represents a crown-like shape and the virus of the and the out which is the outside of the virus. Thus, the virus is named coronavirus. Many of the subgroups include alpha, beta, gamma, and delta. Like COVID-19, the virus shares similarities with the past virus outbreaks. COVID-19 can be easily transmitted through infected droplets. This can happen by talking, coughing, and sneezing. The researchers' purpose of the studies was to understand whether the use of face masks could cause this a lower transmission rate. COVID-19 is what affects the lungs. One of the symptoms of COVID-19 is inflamed lungs, which can make it hard for the infected patient to breathe. These symptoms, such as inflamed lungs, can lead to pneumonia. What are some of the safety precautions we're taking? One of them is going virtual. Some distance, some social distancing is staying at home as much as possible to prevent the spike of cases. This practice is to keep from coming into contact with an infected person. Many schools, such as Laredo College and many schools around Laredo, Texas, have taken safety precautions to close down the schools to stop the spike in cases. Many schools and workplaces have adopted virtual communication, such as Zoom meetings and Microsoft Teams. These applications have allowed many individuals to continue their meetings through virtual set conferences. Another one is social distancing. Many countries around the world and Laredo have implemented the social distancing rule. This rule was implemented to keep the people far enough so that it will make it hard for the virus to spread. This rule requires people to stay at least 6 feet away from each other. Many of the social distancing requirements are to prohibit social gatherings, large events, and the closures of many schools. Stopping social gatherings can help lower the transmission rate and slow the numbers in the hospitals and many patients with severe cases. Some of the research questions I plan to answer for next semester is, what is the possible vaccine date? How has the vaccine, if any, affected the community? Will this be the new normal? Questions. Thank you.